Hello, I'm Dr. Sean Wharton. I'm the co-director of the Canadian Bariatric Clinic here in Burlington, Ontario. I've been practicing internal medicine and bariatric medicine for the past 3 years now. Prior to becoming a physician, I was a pharmacist. I graduated from the University of Toronto in 1990 and then did my doctorate in pharmacy. I then graduated from U of T Medicine and went on to do my residency at McMaster in Hamilton, Ontario. During my residency, I trained under Dr. Arya Sharma. He is the chair in obesity and research in Canada. I then opened up the Canadian Bariatric Clinic. The co-directors of this clinic are Dr. Joseph Berlingeri and Dr. William Nisker. This lecture series is an overview of obesity and bariatric medicine. And the purpose of this lecture is to inform patients about the scientific area within bariatric medicine, as knowledge is the key ingredient to losing weight and to keeping it off. The CBC lectures are designed to teach patients and family members about the underlying causes of increased weight and the current treatment options. Your success will depend on your ability and willingness to receive and incorporate the knowledge in these lectures. The outline of these lectures will include a definition of obesity and definitions of weight. We'll also talk about the prevalence of obesity in Canada, and then we'll move on to talking about the causes of obesity, including genetic factors, environmental factors, and psychological factors. We will then discuss the Canadian Bariatric Clinic treatment strategies. First of all, we should ask a few questions. Who is the CBC, and why did we name ourselves after a radio or TV station? What is bariatric medicine? And are we just another commercial program at drlosealotofweight.com? And what do we mean when we say that obesity is not your fault? Most people feel that they eat, they gain weight, therefore it's their fault. Well, we'll inform you why this is the case, and it may not be entirely your fault. First of all, when we look at the word bariatrics, baro means weight or pressure in Greek. Therefore, bariatrics is the branch of medicine that deals with the causes, prevention, and treatment of obesity. We're going to try to establish a paradigm shift here at the CBC, and a paradigm is a way of thinking. And the old paradigm of thinking about obesity is that the cause of obesity is a lack of sustained willpower, that this is your fault. Therefore, the solution should be, I will try harder and use more willpower and eat less and exercise more. Well, this paradigm is wrong. And what is wrong with this old paradigm? Well, the main thing is that it doesn't work. You cannot just use willpower to eat less for the long term. It is not sustainable. You can ask anybody or you can ask everybody. It doesn't work. The best data we have on willpower is from Weight Watchers, where they have a 3.2 success rate at 2 years. That means there's a 97.8% failure rate. And why is this that the old paradigm does not work? Well, it's because we have not addressed the overactive neurochemicals that lead to obesity, and they will win every time over trying to sustain your willpower. Therefore, taking a look at this paradigm shift away from the old paradigm to the new paradigm, I will explain the new paradigm in regards to what we believe is the major cause of obesity. The major cause is overactive neurochemicals and environmental influences lead to obesity. Therefore, the solution is to work long-term with specialists to gain knowledge to correct these neurochemical or brain chemical imbalances and to change these environmental forces.